Today we will discuss about the suboccipital region. Here you can see this is the prone position of the cadaver, and this is the we are dissecting on the left side. So first of all, I have reflected the skin from the midline incision from the external occipital protuberance to the midline up to the T12, uh, and I have reflected the skin of the posterior side of the scalp. And once I removed it, you can see here there is a fatty layer and there is a deep fascia along with it. Some portions of the deep fascia here you can see, but remaining portions I already removed from the cadavers. So this is the deep fascia, and after removing this deep fascia on the upper sides, here you can see this is a deep fascia along with the fatty layers, and I have cut it. And after this deep fascia, just deep to it, I have cut the table trapezius muscle from the mid part, and here you can see this is a trapezius muscles which is cut from the upper part superior knuckle lines to the external occipital protuberance to the T12. I have cut the trapezius, and here I also cut this over the upper border of the spine of the scapula. I have cut, remove the trapezius muscles. Once I reflect this trapezius, you can see this trapezius. Once I reflect this trapezius on the lateral aspect, you can see there is a muscles which is attached to the scapula. This is the spine of the scapula, and just upper border of the spine there is a trapezius attached, and lower border I have attached the deltoid, posterior fiber of the deltoid I have reflected. You can see there is a just above to the spine there is a supraspinatus, below to it is a infraspinatus, along with it there is a teres minor, this is a teres major, and this lower fiber this is a latissimus dorsi. But right now, and we will not discuss for the suboccipital region, but I will show you the muscles. This is the medial border of the scapula, and along with it there is attachment of the rhomboids major, and just on the level of spine this muscle it is the rhomboids minor, and on the upper border this fiber which is the going on the levator scapulae. So these are the levator scapulae fibers, and this is the splenius capitis muscles. So first of all, in first layer I have reflected the uh, trapezius, and you can see there is another muscles just below to it, there is a sternocleidomastoid muscles. This is a sternocleidomastoid, and trapezius both are the first layer of the muscles of the suboccipital region. After the first layer I have reflected these muscles. You can see there are other two. Second layer there are two another muscles, it is the levator scapulae and splenius capitis. I have cut this splenius capitis. uh, Capitis, from the capitis means head, occipital region, and it is a table shape, and it is goes upwards and laterally towards the mastoid process. So second layer, there are two muscles, levator scapulae, and this is a splenius capitis. Here you can see this now greater occipital now, it is a thickest cutaneous now, which is piercing to the semispinalis. After the second layer, there is a third layer muscle, it is the semispinalis capitis and the longissimus capitis. So medially there is a semispinalis capitis and laterally longissimus capitis. Both I have dissected and reflected this both the muscles. After that, into the fourth layer, you can see the muscles of the suboccipital region. These are the muscles. It is a smaller one, medial one. It is the rectus capitis posterior minor. This is the rectus capitis posterior major. This is the muscles which is superior oblique muscles, and this one is the inferior oblique muscles. And this triangle, which is it is called the considered as a suboccipital triangle, and mostly it is used whenever there is a lumbar puncture which is fail. At that time, we can do the cisternal puncture, the neurosurgeon approach for the cisternal puncture, as well as the neurosurgeon approach for the any occipital lobe injury or tumor or cerebellar tumor. The neurosurgeon approach from this region, suboccipital region. So you have to remember, I will show you the some nerves. Here you can see this is a inferior oblique. Just below to the inferior oblique, the nerve which is passes, it is the greater occipital nerve. It is the thickest cutaneous nerve which pierces to the semispinalis capitis, which pierces to the splenius capitis, and then it becomes cutaneous, and which is innervate to the whole of the scalp, skin of the scalp till up to the lambdoid sutures. So after that, you can see this is the just below to this greater occipital. Another nerve, it is the this is the bunch which is the third occipital nerve, and this third occipital nerve, it is coming from the C3 fiber, greater occipital nerve which is coming from the C2 fibers, as well as there is a greater occipital which is along with the also a fiber of the lesser occipital. Here you can see this is a lesser occipital nerve. So uh, greater and lesser occipital which is coming from C2 fibers, and inside here you can see inside the suboccipital triangle there is another nerve. It is the fiber of the dorsal ramus of the C1. This dorsal ramus of the C1, which is uh, gives the muscles of the suboccipital regions. It is mainly rectus capitis posterior minor, rectus capitis posterior major, inferior oblique, and superior oblique. All these muscles which is innervated by the C1 fiber, it is called the dorsal ramus of C1. It is considered as a suboccipital nerve. Along with it, here you can see this is the vertebral arch, C1 posterior vertebral arch, and here you can see this is the vertebral artery, third part of the vertebral artery you can see inside the suboccipital triangle. Also, I have cut the venous plexus, which is the this bluish color. All are veins, which is I have cut. It is the suboccipital venous plexus. This suboccipital venous plexus, internally it is connected with the vertebral venous plexus, and it is connected to the through the emissary vein. It is connected to the sigmoid sinus. So inside, you have to remember, inside the suboccipital triangle, the fiber of the C1, it is the dorsal ramus. It is considered as a suboccipital nerve, and it supplies to the muscles of the suboccipital region. Just below to the inferior oblique, the another nerve, it is the thickest cutaneous nerve. It is a greater occipital nerve, and this greater occipital nerve, it is the thickest cutaneous, which is pierced to the semispinalis capitis, pierced to the splenius capitis, and it becomes a cutaneous after it supplies to the skin of the back side of the skull up to the lambdoid sutures. And just below to this C2, there is a fiber of the C3. Along with it, there is a terminal part of the occipital artery. You can see here. This is the terminal part of the occipital artery, and C3 uh, fiber. It is called the third occipital nerves. So, in short, in revise, I will show first layer. You can see there is a muscles. I have reflected. First of all, I have reflected the skin. Then there is a superficial fascia and deep fascia. Along with it, there is I have reflected the first layer of the muscle. It is trapezius and sternocleidomastoid. Second layer muscles, I have reflected the levator scapulae and splenius capitis. Third layer, I have reflected semispinalis capitis and longissimus capitis. Into the fourth layer, you have seen the muscles of the suboccipital region. It is the rectus capitis posterior minor, rectus capitis posterior major, superior oblique, and inferior oblique muscles. Main function of these muscles, suboccipital muscles, which is mainly have a role inside the atlanto-occipital, uh, uh, atlanto-occipital, as well as atlanto-axial joints. They have a rotation of the both the moments, rotatory moment and nodding moment, which is very helpful to roll into the these muscles, mainly the suboccipital region muscles, mainly for the atlanto-occipital and atlanto-axial moments. I will show you the other nerves. You can see here, this is a sternocleidomastoid muscles. Just you have to remember there is a, now I will show you, I have just rotated the cadaver on the slightly on the right side, and lateral view you can see this is the nerve which is goes inside the trapezius, and this nerve, it is the spinal accessory nerve. So this is the spinal accessory nerve which supplies to the trapezius as well as the it supplies to the uh, sternocleidomastoid. Another nerve which is coming from the backside and it is goes upwards towards the auriculi, towards the ear. This is a great auricular, and this great auricular which innervate the skin on the front and back side of the ear. It is anterior division which supplies to the angle of the mandible and in front of the skin over the ear, and the posterior division it supplies the skin over the sternocleidomastoid muscles. The main characteristic of the this great auricular, which is a fiber which is coming from C2 and C3, this fiber, it is a lesser occipital nerve, and this lesser occipital nerve innervate to the lateral side of the skull, on the back side of the, it goes wind around to the spinal accessory nerve, and it goes upwards just behind to the sternocleidomastoid muscles, and it supplies the skin around to the lateral aspect of the scalp, on the back of the scalp, just medial to the mastoid process and lateral to the midline. These portions, which is the skin innervated by the lesser occipital nerve, and the lesser occipital nerve always wind round to the spinal accessory, and fiber of the lesser occipital, it is particularly fiber of the C2, and the another nerve which is goes transversely, and it is goes inside the anterior triangle, it is the transverse cervical nerve. So this is a transverse cervical nerve. This all cutaneous nerve which is emerging from the just middle of the sternocleidomastoid muscles on the back sides, and this nerves which supplies the skin over the back of the skull, and on the transverse cervical it supplies the skin over the anterior triangle. So hope you understand the all the muscles and boundaries of the suboccipital region and muscles of the suboccipital region. Thank you very much.